The way we measure visual acuity in infants, say up to age 12 to 18 months or so, is with teller acuity cards, or preferential looking. Because the child cannot obviously tell us if they can see the letter A or A, B, E on the eye chart, we have to do the measures for them. And so behaviorally, infants love to look at things that are of interest in contrast. And so that's where the teller acuity cards come into place. So the way we perform the teller acuity cards is I pull out the card and there is a set of stripes on one side, but I don't know which side it is. And if you, like an infant, when I hold it up, you will look towards the side that has the big stripes on it. And I'm looking through the peephole, and then I can look at their eyes to see if they fixate on one side versus the other. And I will determine that, okay, it was one side, then I go and I randomize and I go to the other. Remember, I don't know for sure which side it is. This is a test of me, not the infant. And so they're going to look at the big stripes, all right? And you say, oh, that's cool. Anybody can see that, Dr. Hatch, right? So then we go to smaller stripes, and these are all age normed. We can even hold them up and down if they get bored side to side. As you can see, I'm using white gloves because we want to make sure that the background of the contrast stays exactly the same all the way along. And then we just keep getting smaller and smaller stripes until we get to a point where the child does not show a preference. That's where it comes out. The term comes for preferential looking. So here we go on this one. Believe it or not, there are stripes on this card. Not many 5-month-olds are going to be able to see this. But up around age 20 or 24 months, if they're still cooperative for the test at that point, we can measure to very fine acuity. In this case, this goes down to about a 20/60 visual acuity.